when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs.
The lad who was driving got blood coming out of his face.
To save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them.
He's absolutely locked in. Okay, good.
To deliver cutting-edge emergency medicine.
Yeah, we're just going to go to sleep. He's not looking particularly good.
At high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
Just going to have a general anaesthetic here, okay? Let's do this. The next 24, 48 hours are critical, unfortunately.
High risks.
Quite a significant collision.
Rapid extrication and go from there.
Oh, good guy.
He's got a massive hematoma forming on there.
And high drama.
This female now, she's about to stop breathing, and then subsequently her heart will probably stop.
Calm down. Try and slow your breathing down for me.
The spa town of Harrogate is famous for its elegant Victorian buildings. But today, one historic home has been the scene of a serious accident.
Everyone happy? Yep. Wind's pretty light.
Dr. Brian and paramedics Matt and Rachel are heading to the scene.
Somebody's fallen 30 foot off a ladder. They've been reported as being combative, which usually means they're agitated, which usually in my experience is due to a primary head injury. We're off to see what's going on there, but my first thought is that this gentleman's going to need a general anaesthetic to transfer him to the Leeds General Infirmary Emergency Trauma Centre. But obviously we get there may be other injuries such as his pelvis or his back or his spine, and we'll assess him when we get there, but my primary thought is he's going to need to go off to sleep to secure his airway and prevent further brain damage. Alright, it's pretty much in the centre of Harrogate, isn't it? Oh yeah, down by the straight. Yeah.
Ground paramedics are treating the patient. It appears he was repairing gutters when he fell.
I'm at 9-8 from the air desk. Matt, do you have any ETA to this grid over?
5 minutes on top. Yeah, we're showing 5 minutes over.
Yeah, the crew are still on scene. They're really struggling with this patient. They've actually requested another ambulance to assist as well over.
Yeah, no problem.
More updates from the accident scene are coming in. It seems the patient is getting increasingly combative.
There's 2 DCAs on scene and he's advised them to scoop and IV lines.
Roger. So you see the building with the scaffolding on it as the trees sweep around? Yes. Yeah, so I was thinking of parking you in this field, just here, but in that top corner. Matt, where's the incident? Right through, see the building with the scaffolding on it? Yeah, got it, thanks. Come towards us underneath the tree just after the junction.
Pilot Scott is landing on the Stray, a common right in the centre of town.
Nobody on that top corner. That's on final approach. Alright, that's us committed about there. Just an inch forward so the birds can get out of the way. Happy there? Yeah, it's fine. 9-8 London.
Yeah, it is.
Okay, yeah, I'll clear doors.
The medics already on scene are fighting to save their patient. Dr. Brian is a welcome arrival.
Oh, I tend to be one, yeah?
Sorry, I don't think
That's okay.
Ryan's 31. He has come from up there, landing as you see. He's only just really stopped being that combative. We were struggling to hold him down. He's had bleeding from his right ear and his nose from straight away. He was initially talking to us, but his GCS is probably about 8 now.
Okay, fine.
Ryan has a serious head injury. He fell more than 20 feet.
Come on, mate. Come on. I'm going to strap you up now. All right. You've got it so she can't move, okay, Ryan?
Are you out 2 at the bottom then?
On, lift.
Right,
One,
ready.
2, 3, lift. Come off the ladder about halfway down.
Right, just careful, there's some stuff stuck to the bottom of him.
Ryan has a bleed on the brain. Pressure is building up inside his skull and causing his aggressive behaviour. He's been fighting his rescuers. Ryan's workmate is shaken. He saw it happen.
So he's going to have a general anaesthetic here, okay? You okay? Yeah, sure. Okay, so you okay?
Dr. Brian wants to put Ryan into an induced coma.
Let's settle things down a bit.
It's a procedure called an RSI, usually carried out in hospital, and it's proven to save lives. But it demands flawless preparation to ensure every step is done by the book.
So size 3 blade, a bougie, and an 8.
Paramedic Rachel will help deliver the drugs in a precise order.
Right, so Rachel's do the drugs. Matt, you're going to pass me kit. Okie dokie. So Rachel, whenever I say it, just all this.
Yep.
All 3. So it's that one first of all.
Yep.
Then that one.
Yep.
And then that one.
Right, and all of it for all of them?
Yeah.
Pre-oxygenation in progress,
Yes.
nasal cannula
Yes.
in place. Drugs drawn up and labelled and dose confirmed.
It's 100 of rock,
Yep.
140 of ketamine, and 200 of fentanyl.
Bougie, adult, 2 OPAs, MPAs in the bag.
Fine.
Scalpel, tracheal dilators for
In the
a
bag.
surgical error.
Great. Anyone not happy? Good, go.
Ryan's being given a drug to paralyse him.
Right, Roxanne. Right, you're at 40 seconds.
Then anaesthetic.
Can you bougie, please? Bougie.
And finally, the team are intubating him.
Cords, going through the cords.
Tube is on the bougie. I have the bougie.
Through the cords, take the bougie out.
Bougie's out.
Thank you. So he's anaesthetised now, yeah? So just turn that off, would be great.
Yeah, that's fine.
Both sides, yeah?
Yeah.
So A's fine, B's fine, C, the cardiovascular, blood pressure. We need to keep that high this time.
Now it's time to make a run for hospital. Seconds count in head injuries. He's going to be flown 15 miles to Leeds General Infirmary and its major trauma centre.
Off the deck man, NR2 maintained, and the fluid's fine. That's almost a clear area, that, isn't it? Yeah, let's do this.
Dr. Brian is monitoring Ryan carefully. His condition is very serious.
That's from 98, so that was lifted from Harrogate, routing to LGI. So we've anaesthetised him on the scene, popped him into a coma, and we're transferring him now to Leeds, which is about 20 minutes away, as opposed to hard to manage in the back of an ambulance and taking a lot longer than that. His position is such that he's landed and hurt his brain, basically, so he's had brain injury, the severity of which we won't be able to assess until he's had a scan of his injury, and until the sedation has been stopped and he's in intensive care and woken up. The next 24-48 hours are critical, unfortunately.
Pilot Scott's a newcomer to Leeds and the rooftop helipad of LGI.
I'll on top it first, then circle around the winds, run my right 3 o'clock.
It's a tricky place to land.
98's finals for LGI.
But Scott pulls off a smooth touchdown.
Movers down, 98's landed.
Ryan is going straight to resus for scans to his head and pelvis. Neurologists have been called to examine him. His life is on the line. It's the hour before nightfall over East Yorkshire.
First shift, Gasping, we're off over into dark.
Where's this job? I only got
Cottingham at Hull, and is an off-duty heart paramedic saying that both patients are unstable.
Cottingham Hull?
Yeah.
2 vans have collided head-on on a country road.
NS98, we've got 8 minutes to them.
Paramedics Tyrone and Daz will be working with Dr. Dave.
We've got an RTC where there's 2 casualties trapped within the car. We don't have much further information. We don't know whether it's a rollover, whether it's a high-speed collision. But when you've got 2 people unwell, we have to think of, multi-limb injury and child abdominal injury. So we're dashing. We've just finished at a job in the hospital. We've just dashed across to get back to the aircraft, and really we just have to wait and see what we find. It's getting wet outside. It's getting dark, so those are all factors that's going to make it quite challenging to assess the casualty. But it's one of those situations where somebody may end up needing to go to the major trauma centre.
6 minutes. 6. Can you see blue lights in the distance?
No, not yet.
See, so look beyond the motorway, the air road. Into the middle is like a strip of lights going from 6 to 12. But beyond that is blue lights.
Yeah, there might be actually, I see what you mean. Like right on the nose.
Yeah, I've got.
Pilot Jeff must identify a landing site in the fading light.
So we've got a scene down 12 o'clock.
Yeah, got it, mate, on the nose.
Standing traffic there, isn't there?
Right.
Happy with that's the scene. We're visual scene, we're going to look to land.
Yeah, roger, mate, that's the scene.
Oh yeah, right on the side of the field, aren't you, Jeff?
I think.
Right on the side of the field.
Yeah.
Right, I'll go for the field and then I'll hop up onto the road if you're happy. Can't see up, mate. Say again?
Signpost there in front of you.
Oh yeah, nice one. Oh, good left, mate. We're all lit up at the side.
Good right, mate.
Yep. Oh, good. Thanks, Jeff.
The road's closed, so Jeff can land on it.
Right, we've landed.
The most seriously injured patient was in the front seat of one of the vans. He is in the care of an off-duty paramedic from the ambulance service's rescue team.
This is Alan, he's coming out. He was passenger in this one. Two vehicles have collided. Initially got here, he's had no radial pulse, a very poor carotid pulse as well. But because of how he's been slumped over kind of centre console, so I've just not been able to get much.
Passenger in the car, seatbelt
passenger in the car, seatbelt one. Yeah. Driver's still in there because he's mechanically trapped. So the plan was just rapid extrication. Driver's fairly stable. Okay. Rapid extrication. Yeah. We'll get him in where it's warm, start doing a bit more of a practical assessment of him at that point, and go from there.
Hi guys, how you doing? We'll just get pelvic binder on quickly here and then get on
here and then
because it's easier 3-6 access.
Yeah, that's fine.
Alan, my name's Darren. Can you hear me still? Can you tell me where most of the pain is? Down your tummy. Down your legs. Okay. Can you just straighten your legs for us, Alan?
Alan Backhouse was on his way back from work when the crash happened.
Okay, folks, you can let go of that now. That's perfect, mate. Thanks a lot for your help.
The update we got was that there was 2 people trapped on scene with a collision between 2 cars. It appears to be 2 vans and it's a high mechanism. It's quite a significant collision. There's an off-duty heart paramedic, Alex. He's been on scene and assisted with the extrication of the patient that we're going to attend to. That's a reduced GCS, possible pelvic fracture. And he's had a blood-clotting drug, TXA, at the moment, so we're concentrating on him. One driver from the other van was walking wounded. He's in the back of another ambulance, and then there's a driver of the other van. He's waiting to be extricated by fire and the supervisor on scene. With our patient that we're concentrating on with a suspected pelvic fracture, it's potentially life-threatening, as we know that we can bleed into that cavity, so we'll treat him as worst-case scenario.
It seems Alan is bleeding internally. They must identify his injuries and reduce the blood loss.
Alan, is that pain still in your legs, mate? Yeah, try not to move if you can. Yeah, right across it, and your chest as well. Okie dokie.
He's being wheeled into an ambulance, so Dr. Dave can see his injuries more clearly.
There we go, in a nice warm ambulance now, okay?
Cheers, guys. Alan, my name's David. I'm one of the doctors on the helicopter. I'm just putting your clothes off so we can see you.
With Dr. Dave now in charge, off-duty medic Alex can stand down.
I'm on my way into work, actually, ironically, tonight for a shift and come across it. It looks like 2 vans have collided head-on. The occupant of one of the vans has managed to get himself out, but the other 2 guys have been trapped quite nastily as well. So when I've got here, I've started doing a quick assessment of them and seeing what I can do, but with no kit, I've been quite limited, really.
Alan may owe his survival to Alex's prompt treatment, but he's still not out of danger.
What's painful, sir? What's hurting? All your chest? Okay.
The team have decided to make a dash for Hull's major trauma centre by road.
Nasty sharp scratch, sir.
They're giving Alan TXA, a drug that reduces internal bleeding.
Alan, is that pain still in your chest? Where's the most pain? Is it your hips, your legs, or your chest? Across your ribs there. Okie dokie, we'll try and sort that now. Are you allergic to any medications at all?
I'm on metformin.
You're on metformin. Okie dokie. Alan, I'm going to give you something for the pain, okay? It can make you feel quite weird and queasy. Okie dokie. We're here right with you and you're absolutely fine, okay? So I'll just give it nice and slowly. Is that still sore in the chest, Alan? Yeah, okay. All right. Down there in your pelvis, yeah?
Oh, down here.
Yeah. Is that sore and pressing your tummy? Yeah. So Ketamine going in at 1834.
Daz has given their patient ketamine, a powerful painkiller. It looks like Alan's also bleeding into his chest. It can kill.
What does that mean?
You're in the back of the ambulance, Alan, okay? It's all right. It's just that painkiller that we're giving you.
Have a good day.
No, we're not going to let that happen, Alan.
Dr. Dave wants a full trauma team waiting when they arrive at hospital in Hull.
Hi, is that Hull Resus, please? Hi, this is Helimed 98.
Hi, we're coming in by road. RTC approximately 1800. We've got the passenger, injuries, head injury with a GCS of 14, potential chest wall injuries. Treatment-wise, he's had pelvic binder, TXA, ketamine, analgesia, a medevacs, and our ETA is approximately, I just want to 15 minutes away.
The combined speed of the vans was around 100 miles an hour.
Injury-wise, it's a massive impact, so it could be caused by seatbelt. He may have hit balls like the windscreen, or his head, he may well have hit the dashboard as well. So we're looking at potentially some quite nasty injuries to sort of chest, abdomen and pelvis as well. Although the helicopter would have got us here quicker, we still would have had to put the patient onto another DCA to bring him round to resus. So the decision was to just pop him in the back of the DCA. Also, en route, he was a stable patient that potentially could have been really unstable very quickly. In the back of the DCA, we can do more en route. So I think the DCA was probably the better option in this case.
Alan, is it still painful? Where, across your chest and tummy? Do you want some more pain relief?
Well, it's then moved down.
It may feel a bit funny, but don't worry. Don't worry, we're with you, okay? It's good pain relief. All right, stay nice and still. It's all right, calm down, it's all right. He's got a massive hematoma forming on there. Yeah, that's on his chest. That is a massive hematoma.
Alan's getting worse, and the ketamine can only do so much to relieve the pain.
Really poor chest movement that side, isn't it?
Oh, damn it.
The ambulance has covered 15 miles in 12 minutes, and it's arriving at Hull Royal Infirmary. For Alan, time is of the essence. He desperately needs emergency surgery. When the sun sets, the air ambulance team used to go home. Not anymore. Thanks to military spec night vision gear, the team can see in the dark.
So, what village is that there? Middleham. Oh, it is the Gallops then, yeah. So it's just before the Gallops.
Tonight, paramedics Sammy and Tyrone and pilot Mark are preparing to scramble to a medical emergency in the Dales.
Okay, so pre-takeoff then, please.
They're using NVGs, night vision goggles.
Pre-takeoffs. Confirm NVG adjusted and working.
Yep, mine are good.
Roger. Radios and lights.
Okay, so radios, I'll do a quick blast just to double check leaving it are closed, so light strobes are on, NVG we're in.
And brief.
We'll just depart out to the west. Any questions, guys? Nope. Okay, power's coming in. Head to the hover 101 on the blue, lots of greens, 0-0.
Helimed 99 is heading up to Wensleydale.
Air desk from 99 lifted towards Midland. Over.
How long, Sammy?
I have 13 nautical miles. That's 6-7 minutes.
Tyrone will be in charge of the treatment of their patient, a teenager with breathing difficulties.
It's early evening. We've just been called to a young female, 19-year-old, over in the Leyburn area, so it's quite remote. On the call, she was struggling to breathe, and what's known as a stridor, where she's got this high-pitched noise every time she breathes, which that would cause like from a narrowing of the airway. What causes that is things like anaphylaxis, asthma, foreign body, etc. We've also just been informed that this female now is peri-arrest, which means that she's probably struggling to breathe for a length of time, that she's about to stop breathing, and then subsequently her heart will probably stop if she's left untreated. Our dispatcher, Al, he set off the Helimed 98 from Nostell, which has got the doctor on board, because it's a young female that's quite poorly, but we're going to be first on scene and assess and do what we can to help her. It's quite imperative that speed is of the essence now, as she's at that point of going into respiratory cardiac arrest.
Do we know if she's got any other challenges?
Well, I don't know. I was just wondering if she's got like tonsillitis or
yeah,
exactly.
Yeah.
But the fact she's peri-arrest, then she's been struggling for a while, hasn't she?
Yeah.
The helicopter's satellite navigation system is homing in on racing stables where the teenager lives.
So if you look now into the 1 o'clock, you've got the first village, and then it points away down into the valley, doesn't it?
Roger.
Where we're going is just on the tip of the point, but probably short of the next set of bright lights.
I've got a blue flashing light if I come under the gogs.
Yeah, tally that. Is he stationary? If he's stationary, that would be ideal.
I'm going to put a lamp on.
Okay, yep.
Sammy's switching on the searchlight. that will help Mark find a safe landing spot. It's vital he can see any obstacles like power cables that could bring down the chopper.
Do you want to bring the beam down for me, please, Sammy? Yes, that's it. I'll drive the beam into the target. So the landing area, we know we can see the landing area, the rough point where we're going to. I'll update you on the landing site once we get there.
Roger, there are domestics running on my left-hand side.
Roger. NS99, we're overhead looking to land. There's horses everywhere.
There is somebody stood in my 11 o'clock close that will be in the disc. They need to move. You got a visual with that person at your 12 o'clock now?
Yeah, thanks,
They
Sammy.
are moving. They just can't see with me saying shove backwards.
Okay, I'll just put it down here.
Air desk 99 landed.
Yeah, we're down. Dog, Matt? Yeah, I'm happy, guys.
Lana Burton is fighting for breath. She's a stable girl working with racehorses.
Is this your girlfriend, wife, partner?
Girlfriend, yeah. We've been going through a bit of crap recently and we're not sure what we're doing at the minute.
So a bit of depression, anxiety built in?
I think there is, yeah.
Okay. Has she ever had anything like this before?
I mean, she's had panic attacks.
Yeah.
She's had asthma.
But nothing to this degree?
Nothing at this extent, no.
8 million people in the UK have asthma, 12% of the population.
Lana, open your eyes for me. Lana, open your eyes. Try and slow your breathing down for me.
It kills more than 1,000 people every year.
That's it. Nice, big deep breaths for me.
Many, like Lana, with no history of severe attacks.
Well done. Doing really well, come on.
Lana, little needle in your arm, hon.
Lana is in great distress, and if they can't treat her quickly, her life is in the balance. In the Yorkshire Dales, the team are fighting to stabilise Lana, a teenager apparently suffering a terrifying asthma attack.
Don't scratch, sweetheart. There we go, right.
Well done.
Lana, slow your breathing right down for me, please.
Sammy wants to listen to her lungs, but that's impossible at the moment.
Lana, I want you to stop with the noise from your throat so we can hear your lungs. Can you do that for me? That's beautiful. 2 minutes, let me have a proper listen. Atta girl. Good girl, Lana. Yeah, I know
See
it's
what she
scary.
saturates at that
Have a look, just gonna have a listen.
Well done.
Well done. Lana. Just nice and quiet for me.
Many asthma victims experience panic,
Can you do it quietly for me?
but now she's beginning to calm down.
Wonderful. Oh, Lana, that is so much better. Brilliant. Do you want to bring your legs round the side so you can sit up a little bit for me? Put your feet to the floor. That's it, you can do it.
Well done, Lana.
Well done. Keep yourself decent. That's it. Hey, Lana. Bring yourself to the edge of the bed a bit. That's it. Now, if you can sit up and straighten. Let me see you. Can't wait to meet you.
Helimed 98 carrying Dr. Dave is on final approach to the stables.
Right then.
Right, sweetheart, just hold that to your face, hon. Can you hold that to your face?
This is Lana, she's 19 years old. I've had a chat to her boyfriend, although we thought she was formally diagnosed asthma.
Yeah.
She isn't, and she doesn't have an inhaler.
Okay.
20 minutes ago, severe difficulty breathing. Sounds very, very much like a panic attack. Extreme stridor, but all verbal. As soon as you asked her to take the noise out of it, she could do it.
Dr. Dave is bringing his clinical skills to Lana's case.
Lana, open your eyes again for me. This is Dave. This is Dr. Dave. He's going to have a little chat with you. Is that okay?
Sammy's trying to look for something that might have triggered the attack.
Is this damp? I wonder
This
if that's
is damp, yes.
whether that makes her breathing a little bit worse as well.
Stable accommodation. This has been like that. You've got damp on the wall there. I mean, it doesn't take a genius to work out that this is not helping.
Mould is a common cause of asthma, but it's impossible to tell at the moment what Lana's lungs reacted to.
If we just give her a bag of fluid, just to get her hydrated, and we'll just reassess in about 2 or 3 minutes' time.
At last, her condition is improving.
Does that feel like it's getting any easier?
It looks like she's out of danger.
Try sitting up straight and perhaps holding your arms. Make yourself into a bit of a big chest. Can you do that? And do that one. Straighten your arms out. That's it, big chest. That's really good. And then you can fill them up.
But she needs further tests. They're going to take her to Darlington Hospital, 25 miles away.
There we go. You're doing great, Lana.
It's hoped specialists there can identify the cause of her attack and help her prevent another. Before now, she didn't even have an inhaler to relieve the symptoms. In Harrogate, another of the team's patients is making a good recovery after a fight for survival he nearly lost.
Last thing I remember was my breakfast that day. The other guy told me that the gutters come off and fell down the ladder and hit me on the head as I was going up the ladder. And then, yeah, I fell off and hit my head again. And that's all we can piece together because we don't actually really remember it. The guy didn't have his eyes on me, and obviously I can't remember anything.
Rufa Ryan fell 20 feet, suffering a massive head injury.
When the helicopter arrived, one of the surgeons said to my mum, I have to operate on him within the next 15 minutes or else he'll pass away. And yeah, instantly after that, they had to cut my skull open.
His family feared the worst.
There were 8 days I was asleep for, and I should have woke up after 4 days, but I didn't. And I was moving my arms and stuff, and the doctors said to Mum and Dad that might be all the best thing get out of me now.
And I just refused to accept that. We were literally taking it hour by hour, day by day. You just keep going. I don't know how you do it. Just as a mother, it's what you do. It's your child. No matter how old they are, they're still your children.
I feel very lucky. I made it through that actual, because I didn't realise how bad it was when I woke up in hospital.
So Ryan's made, I would say, a 99% recovery. He's just Ryan again. And it's absolutely fantastic.
And she believes he owes his life to the air ambulance team and ground paramedics who started his treatment.
I can't put it into words. I'm just so grateful.
Every weekend, hundreds of bikers take on the jumps at this motocross track near Doncaster. And it's one of the Yorkshire Air Ambulance's most common destinations, with around 20 missions a year to rescue riders who've taken on gravity and lost.
Helimed 98 Alpha, Doncaster radar, low flash message.
Helimed 98 Alpha, just lifted from Nostril. We're routing inbound to the Fat Cat Motor Park, which is inside your zone, just to the east of the A1 at Armthorpe, requesting clearance into the zone.
It's a familiar request for air traffic control too.
You wonder if they say, not again into Fat Cats. Yeah, like we do.
Helimed 98 Alpha is identified, clear to enter controlled airspace, VFR, not above altitude 2,000 feet.
Paramedics James and Ant, with Dr. Chris, have been called to a rider who's had a serious fall.
The reports are sort of with chest injuries and spinal injuries, so just on our way there now.
For Dr. Chris, the fact that the victim was taking part in a high-risk sport makes it no less important.
Inevitably, dangerous sports will have risks associated with them, whether it be you ride a mountain bike or motocross. I think it's quite acceptable people take risks. People smoke, don't they, or drink, so you know, we provide a service for all people.
Okay, I think it's got the DCA on the far side of the site. Do we have any idea, because that's off the track, is it?
They're going to be at the DCA.
I'll go around the back of the wood there.
Yep.
The team have been called in by a local ground ambulance crew.
All good, mate.
Cool. All good this side as well.
All right. Hello. Hello. All right. Just pop that there, sis. Out of the way.
Now this
All
is
right,
Mark.
then. Yeah.
Mark's
Hello,
been
Mark.
going along at a rate
Yeah.
on the straight. He's took his hand off the handlebars to pull his strip of visor off,
Yeah.
and the wheel's gone. He's gone over the handlebars.
Yeah.
He's bent double at his head, neck. If this was his back, he's complaining of central pain from here to about here, severe.
49-year-old Mark Parkinson is in a bad way. Another rider saw it happen.
Just come round the corner, going down the straight. Bike started swinging out at the back. I see it just flipped him over, sort of like landed on his head. And he just kept tumbling then.
How does your pain feel now, Mark?
The warping seems to be working.
It seems to be working, does it? Yeah? Right, I'm just going to have a listen to your chest, OK?
Ant is concerned Mark has a collapsed lung. It can lead to internal bleeding and even death.
He just couldn't breathe, couldn't get his breath, so we're like, "You just winded, Mark, just winded." Took his helmet off, and just the paramedic guy took over from there. I don't think it's going to be anything serious, just a punctured lung.
Any pain where I'm touching?
But Ant is less confident.
Slightly reduced air entry on that side. Breath sounds are a bit quieter on that side.
He fears Mark has a spinal injury. He's been strapped to a rigid stretcher and fitted with a neck brace.
Right. He came right over the handlebars. Yeah. Yeah. Knock it up. They said there was some tenderness
Yeah,
in
the
your tummy.
witness said he bent right in half.
That feels all right, and that feels all right.
Falls on the track have left some riders with permanent disabilities, as local paramedics know well.
It's one of 3 motorcycle parks within Doncaster. This is probably the one we get the most business to, if you like. It is one of the more popular ones, especially on a Saturday and Sunday. You often have a race day on a weekend on the Sunday. So it's just some practices today. So yeah, it is one that generates quite a lot of riders coming off, really.
So I mean, it's going to have to be NTC in it with the potential chest injury. Well, I mean, that numbness is kind of going up, isn't it? I mean, you've got him immobilised.
The team want to fly Mark to the major trauma centre, 20 miles away in Sheffield.
He's been at a motocross event where he's kind of come off his motorbike, gone over the handlebars, going roughly around 30 miles an hour, landed on his head, and his neck's kind of buckled under him. He was in a fair bit of pain prior to morphine, but they querying. He's kind of got lumbar spine pain and some neck pain, but no real altered neurology.
Have you been on a helicopter before?
I haven't, no.
Okay, so all you have to know is it's going to get a bit loud, really. We'll keep giving you a thumbs up, all right? So we're going to take you to Sheffield. It'll take about 10 minutes.
Mark is heading for scans and x-rays on his chest and back.
Plan will be, jumping into your brief, be straight ahead, there'll be turn rights, cross the motorway, and then I can tell him I'm going to be clear of the other side of the motorway.
Good.
Mark's injuries could be life-changing.
So even whilst we're there with Mark, see that the event ambulance service, they're up against some more incidents, so motocross is a pretty risky sport.
We're on a perfect heading for Northern General. Could go almost go straight in. The wind's on the nose for 240.
Very good.
Air turbulence means Mark's had a rough ride into hospital.
All right. Yeah, when you're going straight in the air, it's not too bad, but just as you come in, it does. You have to put some fillings back in, will we?
Surgeons at the Northern General are on standby to examine Mark and observe his scans.
Okay.
You all right there, Mark? You still feeling reasonably comfortable?
The test results could change his life.
Down from air desk.
At Air Ambulance headquarters, dispatcher Pete has an urgent mission.
Yeah, sorry guys, can I divert you to a job at Skipton? It's a cyclist who's come off the bike in the middle of the road.
Head injury, in and out of consciousness with the police.
The team's being diverted to the Yorkshire Dales.
Is it town centre or is it on the peripheries of Skipton, Anthony? Don't know, mate, I've not put the grid in yet. Stop by, I'll have a quick look. Little village called Eastby. Yeah, I know where it is. It's really steep, that descent.
Dr. Dave is familiar with the area, and the patient's injuries sound serious.
He's in and out of consciousness, so he's obviously backed his head. He could have injured other parts of his chest and abdomen or his arms. But our worry is, has he got a head injury, and do we need to put him to sleep to protect his brain from further secondary brain injury?
Comment 99 from air desk. Just looking at the map, I think you're going to be first on the scene.
The position of the accident's been electronically sent to the onboard computer.
Yeah, that's the same. We've got 1 minute to run. We're just looking out for it now.
Yeah, show me where the pin is on...
D4H, you've got a police car there.
Visual 1 o'clock. And it looks like there's a flat area just down by the wall. You can walk up across the cattle grid to the incident.
It's on a steep hillside. Pilot Harry faces a challenging landing.
I'm not promising I can land here, but we'll give it a go. We're right skid up slope, which is our best option. No, that's looking pretty good. Levers fully down, you're clear to unstrap, guys.
The helicopter has landed on the only area of flat ground. Dave, Matt and Ant must hike to their patient. Helen is an experienced cyclist.
Helen, hello. My name's Dr. David.
Hiya.
Are you alright?
No.
Oh, I'm sorry to hear on the floor. What's hurting you?
My shoulder, my right shoulder,
Your
my
right shoulder?
head.
Okay.
Oh, it hurts.
Do you mind if we just check you over and then we'll get you off this horrible floor?
I need to be off the floor.
We need to get a scoop off the helicopter. So whilst we're waiting for that, we'll just check your breathing, everything. All right. But we'll keep you nice and warm.
Helen's accident is a mystery. No one saw her fall, not even her riding partner David.
We came over the hill here and I was in front and I got down to the bottom of the hill and waited for Helen, and after a minute or two realised that she wasn't coming, she wasn't close behind me. So I started to cycle back. And then when I got to the road further down, I could see up the road here, and I saw the wagon parked and a car, and I feared the worst at that point, that something had happened to Helen.
She may have a head injury. Her helmet is badly damaged.
We started asking her questions, and she doesn't have any sort of short-term memory. She doesn't remember where we've been today, but she knew her name and date of birth and things like that.
Dr. Dave must methodically check her condition to rule out life-threatening injuries. He's using the ABC of medicine, checking first airway, then breathing and circulation.
So A's good, B's good, C's good, D, GCS 15, but pain about C, so lower C.
Sounds like she has had a period of...
Yeah.
Let's scoop, I think rather than split it, scoop down back, roll her onto it and straight into it back.
Yeah, we are there. And we'll get IV access when we get onto her back. So
yeah, set of obs when she's on her back.
Yeah, I mean, if she's not tachypneic, she's got a radial pulsar back.
Yeah, okay.
Paramedic Matt is concerned she may have a spinal injury.
Yeah. Well, once we get you onto this board, we've got like a sleeping blanket that we can get you in, and some heating blankets as well. Yeah. All right.
Helen's heart rate is low. It's unusual for the victim of a traumatic injury, and she's getting very cold.
Yeah. Everyone ready?
Yeah.
Yeah. Ready, steady, roll.
No.
It's all right. Okay. Well done. Well done.
There you are. Well done.
That
in now.
My back.
Oh, it's all right.
We're there now.
Dr. Dave thinks Helen may have broken multiple bones in the fall.
Helen, I'm going to just cut your jacket just to check this right shoulder of yours, okay?
Yeah.
All right.
They're keeping her back straight to avoid worsening any spinal injury.
Yeah, I'm fine.
Is it sore around here, Helen?
Yeah.
Okay.
The arrival of ground units means there's no shortage of manpower or shelter.
Right, Helen, we're going to get you onto a trolley into somewhere a bit warm out of the cold, okay?
Yeah.
A local traffic cop must call in investigators if Helen's injuries are life-threatening.
So what we're going to do, we've now ambulances here, we're just going to put her on board, have a look at her. Just give us 5 minutes on back of there just to have a quick once over, and then we'll give you a decision based on that. Right, yeah, no, cheers.
Ready, steady, lift.
The team are still unsure. Dr. Dave has his suspicions.
It's probably a significant neck injury and head injury. The helmet's absolutely shattered, but it's kept in place by the plastic outer casing, but she certainly walloped it.
Helen is about to undergo a full examination.
Just a quick update, mate. We've just got a package up off the road and there's a DCA here, so we've got her in the DCA to get her warmed up. At the moment, she isn't triggering for a bypass other than step 4 with her age, so Like I say, they're going to give her another reassessment and then just weigh up whether she's appropriate to go to Airedale with the road crew.
The team have an option to allow Helen to go to hospital by road. She could be arriving at the main A&E unit in the Dales almost as quickly as they could fly her to Leeds.
I think we've got head injury that needs to scan. Neck's going to just need clearing. So, I mean, I think I'd be happy to go locally here. If everyone else is happy with that. Yeah.
Yeah, cheers guys, see you later.
Helen is going by road. Scans will reveal the seriousness of her head injury and perhaps solve the mystery of the cause of her accident. Doctors discover Helen has broken her shoulder as well as her pelvis and 13 ribs. She was also fitted with a heart pacemaker during 3 weeks in hospital. But she still can't remember the reason for her fall. Alan, the van passenger trapped after a head-on crash, was found to have a torn artery in his chest. He needed 2 units of blood and suffered a collapsed lung. His pelvis was also broken. Lana, who suffered a severe asthma attack, has traumatic memories of the night it happened.
The bits that I can remember, I'd say I was more panicking. Because I couldn't breathe. I wasn't really thinking about anything else. I was just thinking about I need to be able to breathe.
She's very grateful to paramedic Sammy.
Once I was sat in front of and I was just spoken to and comforted, and in a way it did make a massive difference. I can't thank her enough for that, because I think if she wouldn't have been there, I don't know what would have happened, but I'm glad she was there.
She has undergone extensive tests to determine the cause, and she's been warned to dial 999 if it happens again.
Knowing that everyone came out, you know, to make me better was a nice feeling but scary at the same time, but I'm glad that they both, you know, came out to help.
Biker Mark was lucky to survive his accident on a motocross track.
I needed an emergency operation because I tore my aorta to my heart, so I had to have emergency stem cell fitted. And then I'd actually broken all the bones in my back, and I'd broken all the ribs in my back. When he was telling me all this, I thought he was talking about somebody else. It just seemed, I couldn't believe it, you know, all the things that I'd broken on one fall, because I've done it for a long time and never really done anything that bad before.
And he's made a decision. He's giving up biking.
I'm pretty much past it now. You don't bend the same when you fall off. I used to fall off loads of times and fly across the floor and that, but now you fall off and it just hurts. And things just break, whereas they didn't when you were a bit younger, so I probably just watch my lads now.
His new DIY hobby is a bit safer.
I hope to get the house finished as soon as I can. It's been a long process, but it's getting there eventually.